Tumor necrosis factor alpha is a potential biomarker for evaluating disease severity in immunoglobulin A nephropathy. Immunoglobulin A nephropathy is one of the common causes of primary glomerulonephritis. Tumor necrosis factor alpha is a kind of pro-inflammatory cytokines which has an important role in the pathogenesis of immunoglobulin A nephropathy. A recent study had shown that hydroxychloroquine targeting cytokines, including tumor necrosis factor alpha, was effective in decreasing proteinuria. The aim of the study was to investigate the role of serum tumor necrosis factor alpha in evaluating disease severity in patients with immunoglobulin A nephropathy. Individuals with immunoglobulin A nephropathy were included in the study. Some healthy individuals who had no kidney disease were also included in the study. Patients with lupus nephritis, enoxacontin purpura, liver cirrhosis and other secondary causes of immunoglobulin A nephropathy were excluded from the study. The study included 273 individuals, in which 147 patients with immunoglobulin A nephropathy and 126 healthy individuals were included. Serum levels of tumor necrosis factor alpha were measured by chemiluminescence immunoassay. Estimated glomerular filtration rate was calculated using the chronic kidney disease epidemiology collaboration equation. The association between level of tumor necrosis factor alpha and clinicopathological features of patients with immunoglobulin A nephropathy were assessed. The serum level of tumor necrosis factor alpha was significantly higher in patients with immunoglobulin A nephropathy as compared to the healthy subjects. The receiver operating characteristic curve analysis showed that tumor necrosis factor alpha levels were better at discriminating the patients with immunoglobulin A nephropathy and healthy subjects than estimated glomerular filtration rate. By multivariate linear regression, it was found that serum levels of tumor necrosis factor alpha were positively associated with 24-hour urine protein excretion, serum creatinine, urinary protein to serum creatinine ratio, and cystatin C in immunoglobulin A nephropathy, and negatively associated with estimated glomerular filtration rate, after adjusting parameters like sex, systolic blood pressure, and diastolic blood pressure. Patients with tubular atrophy, or interstitial fibrosis or mesangial hypercellularity, score showed higher serum levels of tumor necrosis factor alpha. Serum levels of tumor necrosis factor alpha were closely associated with disease severity in immunoglobulin A nephropathy. Therefore, serum tumor necrosis factor alpha could be a potential biomarker for evaluating the disease severity in patients with immunoglobulin A nephropathy.